everyone, welcome to NATCO Studio Room. Today I am back with a great doctor, Dr Anand Dongre from Treat Me Hospital, Nagpur. So welcome to NATCO Studio Room. I would like to know about your insightful thought that will definitely help our younger generation. So I just want to ask you, what is your advice for the younger generation who is working with the ICU department and the antibiotic management?
Yeah, that's true. It has become a sort of problems in coming years for the ICU, that a lot of drug resistance cases are there, and we don't have many of the antibiotics in pipeline. So my take on antibiotic uses will be to use antibiotic judiciously, number one. Number two, find out where is the site of infection first, and according to the site of infection you can always choose the right antibiotic. Use the right antibiotic in a larger dose or better dose or optimum dose, so that and always use a killer drug, not a static drug. So these are the few points on which if one can, because if we want to have cultures, the cultures will go a long way. It will come after 3 days, but on day one, if we can come back with that organism, you can find out a good antibiotic which is a killer and which is in optimum use, then most of the problems of drug resistance will be over. But still there are drug resistance cases which are coming up, especially the organisms which especially Klebsiella and E. coli also becoming drug resistance. Klebsiella is one of them, and you need to have a pipeline of drugs which is available for us in the near future. So use of the drug should be judicious. Antibiotics which are not to be used should not be used in those cases where site of infection is not known, site of infection is hidden, occult site of infection is there. So you can always use the drug judiciously. Judicious use of drug will also help us to combat with the drug resistance cases in India. Thank you.
All right. Thank you so much, Anand sir, for sharing your insightful thought with all of us. And thank you so much for sharing your knowledge with all of us. And yes, we are going to conclude NATCO Studio Room with Dr. Anand. Thank you so much, sir, for coming here.